Hello everyone, I am Dr. Anupama Singh, Assistant Professor in Community Medicine Department, and today I'll be talking about the field level immunization techniques under the immunization schedule. The main objective of immunization activities is to reduce the morbidity and mortality caused by vaccine preventable diseases. It is the responsibility of the health facility in charge to schedule immunization sessions so that they might meet the community's needs and expectations in terms of convenient hours of operation, socio-cultural acceptable standards of quality service, and individual comfort. So I'm sure you're well aware of the National Immunization Schedule. At birth, BCG, hepatitis B and OPV vaccines are given. BCG is given 0.05 ml intradermally in the left upper arm. Hepatitis B is given 0.5 ml intramuscularly in the left anterolateral side of mid-thigh, while OPV is given 2 drops orally. OPV has further 1, 2 and 3 dose. Pentavalent also has 1, 2 and 3 dose that are given at 6, 10 and 14 weeks respectively. OPV, as I've already mentioned, is given orally 2 drops, while pentavalent is given 0.5 ml muscularly, intramuscularly in the left anterolateral side of mid-thigh. Fractional IPV is given at 6 and 14 weeks, 0.1 ml intradermally in right upper arm. Rotavirus is given orally 5 drops at 6, 10 and 14 weeks respectively. PCV, that is pneumococcal conjugate vaccine, is given at 6 and 14 weeks, 0.5 ml intramuscularly in right side of anterolateral mid-thigh. Measles or rubella is given at 9 months, that is 0.5 ml subcutaneous in right upper arm, and JE is also given at 9 months, 0.5 ml subcutaneous in left upper arm. Pregnant ladies are given tetanus toxoid, which is given 0.5 ml intramuscularly in upper arm, and then the second dose is given after 4 weeks. So before we talk about the immunization techniques, let us know what is cold chain. It is a system of storing and transporting vaccines at recommended temperatures from the point of manufacture to the point of use. So from the site of where the vaccine is manufactured, it is taken to the primary vaccine store, which are cold rooms. So there are these huge rooms where the vaccines are stored. And from there, via refrigerated vans, they are transported to different health centers in different districts, where like at the district hospital or the CHCs, where they are kept in ice-lined refrigerators, and then they are further taken in cold boxes to the venue where the immunization has to be carried out. So this is the image of a PHC where vaccines are kept, and now if they have to be taken into the field, they are carried in a vaccine carrier, which is an insulated box, and it can hold up to 16 to 20 vials of vaccines and diluents. And the vaccine carrier consists of 4 conditioned ice packs, which can help maintain the temperature of the vaccines between 2 to 8 degrees for around 12 hours. This is the image of an Anganwadi center where immunization at an immunization day. So now let us talk about the injection techniques. We'll talk about the intradermal, intramuscular and subcutaneous immunization techniques. So as I've already mentioned, intramuscular injections are pentavalent hepatitis B, tetanus toxoid and pneumococcal vaccine. Subcutaneous are mainly the measles and the JE, and intradermal are BCG or fractional IPV. So let us take BCG as an example for intradermal injection. So let us watch this video to understand the intradermal technique better. So BCG is a good example. It is given at birth. So the first step is to counsel the mother or the caregiver and to tell her what is going to happen. Then we have to maintain the cold chain of the vaccine so that the temperature is maintained between 2 to 4 degrees. The health worker should clean their hands properly, wash their hands, and then reconstitute the vaccine. BCG is reconstituted with normal saline. So 1 ml of normal saline is injected into the vial and it is shaken well. Then 26 gauge needle is taken, syringe is taken, and the vaccine is loaded. 0.05 ml of vaccine should be there in the syringe, and the site of injection can be cleaned with plain water. Now the needle should be parallel to the skin. So positioning of the baby is very important. The baby should be comfortable and never clean with spirit or alcohol. It can be just cleaned with plain water. And the bevel of the needle should be facing up, and the needle should be almost parallel to the skin, and it should be slowly injected into the skin. So as you can see here, a lot of resistance is faced while giving an intradermal injection because the intradermal space is very less. So slowly you have to inject the vaccine and a bump will start forming. So you can see that there is this area which is becoming more and more white and a bump is forming. So that is the site where the vaccine is getting injected. So that is a good sign that it is being injected intradermally. So intradermal injections require some practice. So sometimes it can happen that the vaccine can be injected deeper. So in that case, the one who is giving the vaccine, they will feel less resistance because they'll probably they are injecting into the intramuscular or subcutaneous compartments. So there the space is more and they will feel less resistance. So they can reposition the needle and inject again. Disposal or proper disposal of the syringe and the needle is also very, very important, and the mother should be counseled that the site will form a sore, site of injection will form a sore which will crust over after some time and it will leave a scar. So if there is no scar, then the child may require an injection again in the next 6 months. So intradermal injections require some practice. The proper site and position is important. Then the needle should be placed parallel to the skin, and it is important that a bump should form at the site. So we've already talked about this. The BCG is a freeze-dried vaccine which is reconstituted with normal saline. Reconstituted vaccine can be used up to 3 hours and then it has to be discarded. And intradermal 26 gauge tuberculin syringe is used for administration of this vaccine. The site for vaccination is insertion of just above the insertion of deltoid muscle, and a satisfactory vaccination generates a wheal of around 5 mm at the site of injection, somewhat like this. Fractional IPV is also given intradermally. 0.1 ml is given at 6 weeks and 14 weeks. These are the two doses, and it's you can see here in the figure that the intradermal below the intradermal, this intradermal space is very less. So that is the reason why a lot of resistance is felt while giving this while carrying out this technique. So now let us talk about the intramuscular injection technique. Intramuscular, as you can see from this figure, it is given in the muscle and the needle should be at 90 degrees from the skin. So it should be like perpendicular to the skin. So the vaccines that are given IM are hepatitis B, pentavalent, pneumococcal vaccine, and the toxoids, tetanus and diphtheria toxoid. All these vaccines, the dose is 0.5 ml and open vial policy is applied to all of them. So here I'd like to play a video for you to understand the intramuscular injection technique better. So intramuscular injections are given perpendicular to the skin, that is at 90 degree, and this video will tell you how to give an intramuscular injection correctly. So there are a few steps when you need to give an injection, and the first is to welcome the child and the mother or the caregiver, to make them feel comfortable and answer any of their questions or concerns. The way we talk to them will determine how they feel about immunization. It is important to explain to them what is about to happen and how they should position their baby. The second step is to prepare adequately for the vaccination or injection. So washing of hands and preparing a clean table is important. The vaccine should be loaded and kept away from the caregiver so that they don't feel anxious. And if 2 vaccines are to be given, they should be prepared and kept ready accordingly. Now the third step is positioning of the baby. The mother or the caregiver should be counseled appropriately as to how they should hold the child, and usually the upper thigh muscle is used in case of babies is for intramuscular injections. Older children can even be injected in their upper arm. So if 3 vaccines are to be given on the same day, then the site 1 and 2 can be on one leg, like PCV and IPV can be given in one thigh and pentavalent can be given in the other thigh. So location is also very important. Usually vaccines are given in the anterolateral side of thigh. If the skin is dirty, it can be cleaned with plain water. Alcohol should not be used. And gently stretch the skin with one hand. The needle should be at 90 degree to the skin. The bevel should be facing up, as you can see. So push the needle at 90 degrees to the skin and depress the plunger. And pull the needle out completely quickly at the same angle. Try not to rotate the needle. Then the site should not be rubbed and the needles should be discarded adequately. So these are the few steps that should be followed for proper injection technique. So now we will talk about the subcutaneous injection technique, and as you can see in the figure, the needle and the syringe should be around at 45-degree angle from the skin. The two vaccines that are given subcutaneously are measles and JE vaccine. Measles is a freeze-dried vaccine while JE is a live attenuated vaccine. The dose for both is 0.5 ml, and diluent for measles is distilled water while JE is phosphate buffer saline solution, and open vial policy is not applicable to either of these. So here I'd like to play a video for you to understand the
Immunization is a
technique
routine
better.
procedure for health workers, but for children and their caregivers, it can be frightening.
So again, this video will tell you how to give subcutaneous injection properly.
By following a few steps, you
As
can
we've
turn a
already mentioned, these are
subcutaneous
the 6
injection
steps
into a
for
safe
proper
and
injection
positive
technique.
experience.
And the
Always
first
start by
is
washing
to
your hands and preparing a
prepare
clean table to work
by
on.
washing your hands
Whenever possible,
and preparing a
prepare the
clean table.
vaccine away from the child and caregiver.
So the
Seeing the
vaccines should
materials
be
may
also
make them
prepared,
feel
and they should be
anxious.
prepared, that is, if
Once
they
you've
require
prepared the vaccine or
reconstitution, they should be
vaccines,
reconstituted
keep them
away
close at hand
from the
in the
baby and
order
the
you will be
caregiver.
administering them.
Second is to
When the child
welcome
and caregiver
the
arrive, give them a
mother
warm
and
welcome.
the baby,
Smile.
and
Ask if they
if they
have
have
any
any
questions or
questions
concerns,
or
and
concerns,
then take the
that
time
they
to
should be
answer them.
answered properly,
The way you
and
treat and
if they are
interact with
anxious,
children
then
and their
they should
families has a huge
be
impact on
made to
how
feel
they feel
comfortable.
about immunization. Explain to the caregiver what is going to happen
Then
and
they
talk
should
with
be
them about the
explained what
best
is
way
about
to
to
position
happen
their child.
so that they are not afraid. Third is the
Let
mother
them
should
know that
be
holding their child
taught
properly
how to
will
hold
help
the baby.
keep
The
the
position
child
of the
calm
child is
and
very
still,
important,
which will
and it
make
will
the
depend
immunization go
on
more
the type of
smoothly.
vaccine that is to be given and the
There
age
are
of the
5
child.
different
For
vaccination
younger children,
positions. The one you will choose
usually
will depend on the
thigh
number
is
of vaccines
preferred,
to be given,
and
the
older
age of the
children,
child, and what is
even
easiest and most
upper
convenient for
arm
you.
can be a good site.
A subcutaneous injection is
So
given into the layer below the skin
let us
on
see
the
this
upper
figure
right
carefully.
or upper
For
left arm.
subcutaneous injection, the needle and
Always
the
check
syringe
the
are at
national guidance to find out
45
if a
degree,
particular site is
and it
recommended
has to go
for
in
the
the layer
specific
below the
injection
skin.
you are giving. Make sure the infant's arm is bare.
So the
If the
upper
skin looks
arm of the
dirty,
baby should be
wash it with
bare,
water,
and
not
if the skin
alcohol.
is dirty, it can be
Swabbing
cleaned with
clean
plain
skin is
water.
not necessary.
Alcohol should not be used.
Gently squeeze the skin
Then
with one
gently
hand.
squeeze the
With the
skin
other hand, hold the
with one
syringe barrel
hand
with fingers and the thumb on the
and look
sides
at
of
the
the
needle.
barrel.
It is
The
at around
bevel
45
or
degree.
hole
The
of the
bevel
needle
should be
should be
facing
facing
up.
upwards. Quickly and
You can
smoothly push
see
the needle
in
into the
one
skin at a
quick
45-degree
motion
angle.
the
Depress the plunger.
needle is
Take care not to move the syringe around.
at 45-degree
Pull
angle,
the
and
needle out quickly
depress
and
the plunger
smoothly
and
at the same
pull the
angle that
needle
it
out
went in.
quickly. Try
The
not to
caregiver may
rotate
hold a
the
clean
needle.
swab gently over the site if it is bleeding. Soothe and distract the infant.
Then the mother should be asked to comfort the child, and
Carefully put the
the
needle
needle and
and
the syringe
syringe
should
into the
be
safety box.
discarded properly.
You should now know the
So
steps
these
for
are the
giving a
6 steps.
subcutaneous injection. Immunization
So now let us talk about the open vial policy. It is applicable to these vaccines as shown in the figure, that is PP, OPV, DPT, hepatitis B pentavalent. And what does the policy say? So vaccine vials opened in session sites can be used for immunization up to 4 weeks provided that their expiry date has not passed, the vaccines are not stored and the vaccines have been stored and transported under appropriate temperature, that is the cold chain has been maintained, and they have not been contaminated, and the withdrawal of doses was via the aseptic technique, and the VVM has not reached the discard point. All open vials should have a date and time on them, so that it has to be written so that we know when the 4 weeks have passed. And at the end of the session, all open vials are to be returned to the cold chain point, that is the site from which they were they traveled, like they moved from the PHC to a field site, so again they should be taken back to the same PHC. So and segregated to reusable and non reusable vaccines. So usually the BCG, measles and JE vaccines have to be discarded after 48 hours, and it's important, and the rest can be used. So certain vaccines are very sensitive to exposure of heat and light. So the temperature for vaccines must be maintained between 2 to 8 degree, and reconstituted vaccines of BCG, measles and JE are most sensitive to heat and light, and they cannot be used beyond 4 hours of their reconstitution, as there are high chances of infection. So a few words about the VVM. VVM is a chemical indicator, or it is the vaccine vial monitor, and it is like a label that is there on the vaccine, and it shows the color change of the VVM is according to the temperature at which the vaccine has been exposed. So as you can see in the figure, so if the inner square and the outer circle, the temperature is similar, it means the VVM has reached a discard point, right? And it has absorbed enough heat that it is not safe for use anymore. And if the inner square is like darker than the outer circle, then it means that it is like beyond the discard point. So in both these cases, the vaccine should not be used. So what is the take home message today? Clean hands is of prime importance before vaccinating a child. Healthcare worker must make the caregiver comfortable and answer any query that they are having. The vaccines and diluents must be at similar temperature at the time of mixing. Okay, so care must be taken that both are at similar temperature. Cold chain must be maintained at all times for all vaccines. Shake test can be used to detect any damage caused to a vaccine by freezing, and injection techniques can only be mastered with time and experience. Thank you.